Puerto Rico Medical Board style clinical vignettes. Topic: spinal cord tract injuries, Brown-Séquard syndrome, and related lesions. Case 1, Brown-Séquard syndrome. Clinical vignette. A 32-year-old man presents after being stabbed in the back during a street fight. He has weakness in his right leg, along with loss of pain and temperature sensation in his left leg. On examination, right lower limb, decreased strength, increased reflexes, loss of proprioception and vibration. Left lower limb, intact strength and proprioception, but absent pain and temperature sensation below the level of L1. Question: what is the most likely diagnosis? A. Central cord syndrome. B. Anterior cord syndrome. C. Brown-Séquard syndrome. Correct answer: C. Brown-Séquard syndrome. Explanation: Brown-Séquard syndrome results from hemisection of the spinal cord, causing ipsilateral, same side, loss of motor function, vibration, and proprioception due to damage to the corticospinal tract and dorsal columns. Contralateral, opposite side, loss of pain and temperature due to disruption of the spinothalamic tract, which decussates 1 to 2 levels above entry. Case 2, anterior cord syndrome. A 70-year-old man with a history of atherosclerosis presents after a hypotensive episode during surgery. He has bilateral loss of motor function and pain temperature sensation below the level of T10, but vibration and proprioception are intact. Question: which spinal artery is most likely compromised? A. Posterior spinal artery. B. Artery of Adam Kiewicz. C. Anterior spinal artery. D. Vertebral artery. Correct answer: C. Anterior spinal artery. Explanation: the anterior spinal artery supplies the anterior 2/3 of the spinal cord, including the corticospinal and spinothalamic tracts. Dorsal columns, vibration, and proprioception are spared because they are supplied by the posterior spinal arteries. Case 3, posterior cord syndrome. Clinical vignette. A 58-year-old woman with a long history of untreated syphilis presents with difficulty walking in the dark and frequent falls. Neurological exam shows positive Romberg sign, impaired vibration and proprioception, but normal strength and pain perception. Question: which of the following spinal cord structures is affected? A. Corticospinal tract. B. Dorsal column. C. Spinothalamic tract. D. Anterior horn. Correct answer: B. Dorsal column. Explanation: this is posterior cord syndrome, commonly seen in tabes dorsalis, neurosyphilis. Affects gracile and cuneate fasciculi, vibration, and proprioception. Case 4, central cord syndrome. Clinical vignette. A 66-year-old man presents after a fall. He has weakness in both upper limbs with preserved lower limb strength. He also has loss of pain and temperature sensation in a cape-like distribution over his shoulders and arms. Question: what is the most likely diagnosis? A. Central cord syndrome. B. Brown-Séquard syndrome. C. Complete cord transection. D. Subacute combined degeneration. Correct answer: A. Central cord syndrome. Explanation: central cord syndrome often results from hyperextension injuries, particularly in older adults with cervical spondylosis. Affects central part of spinal cord, damaging decussating thalamic fibers and corticospinal fibers for the upper limbs.